Hello everyone, I am Dr. Anirudh J Shetty. I am a consultant endocrinologist in the Department of Diabetes and Endocrinology at Narayana Health City, Bangalore. I'll be discussing about the topic diabetes and its complications. So coming to diabetes and its complication, the reason why we treat diabetes is to prevent the major complications of diabetes, and the complications of diabetes can be divided into acute complications and chronic complications. The acute complications of diabetes include DKA, something called as DKA, diabetes ketoacidosis, which is commonly seen in type 1 diabetes, where there is complete lack of insulin and there is increased acid formation in the body. And the other is something called as HHNK, or hyperosmolar hyperglycemic non-ketotic coma, where the blood sugars are very high and they are in a state of coma. It's commonly seen in type 2 diabetes. So coming to the chronic complications of diabetes, so it can be divided into microvascular and macrovascular complications. So in macrovascular complications, you have CAD, that is the affecting the heart or the coronary artery disease, and you have the cerebrovascular disease, and you have something called as the peripheral arterial disease or PAD. In microvascular disease, it can be divided into diabetic neuropathy affecting the nerves, diabetic retinopathy affecting the eyes, and diabetic nephropathy affecting the kidneys. So coming to the individual macrovascular complication, the coronary artery disease is 2 to 5 times more common in diabetic patient when compared to a non-diabetic individuals. Also, a patient with diabetes is considered to be a CAD equivalent, that is a coronary artery disease equivalent, meaning non-diabetic patient with coronary artery disease is considered to be equivalent to a patient with diabetes. Hence, it is very important to prevent cardiovascular complications in diabetes, and also it is very important to keep a very good glycemic control. Coming to the next macrovascular complications, that is the cerebrovascular disease or stroke. So basically there are two types of stroke, hemorrhagic and ischemic. So hemorrhagic is where the vessels rupture and ischemic is where there is blockage of vessels. So both the strokes are around 2 times more commoner in diabetic patients when compared to non-diabetic patients. And coming next to peripheral arterial disease. So peripheral arterial disease is basically occlusion of one of the major extremity vessels. Again, it is 2 to 4 times more commoner in diabetic patients. They can present with non-healing ulcers. So diabetic patients are at more risk of advanced peripheral arterial disease, and they have usually infrapopliteal disease, that is the lower aspect of the leg. So it is very difficult to treat these patients, and patients who have peripheral arterial disease are at an increased risk of cardiovascular events.